So I'll be making the knee synovial joint model, and so far my stuff I have is just 2 pipes, one for the femur and then one for the fibula and tibia. So I'm gonna sand these down, and then after I'm gonna spray paint it and then paint it white so I can attach things onto it. Okay, I just finished spray painting these grays, so I can now paint them white to represent the fibula, tibia, and the femur. Alright, so I just finished painting the 2 pieces of my pipes here. This one will be the femur, and this one will be the tibia and fibula. So all I'm going to do is just trace an image, and then just color around it. Alright, so it is the next day, and I finished drawing the femur and the fibula and tibia. We got the anterior view and the posterior view of the femur, and the anterior and posterior view of the fibula and tibia. It'll be the right leg, so it'll go like this, and then a ball will go in between them and be able to rotate. So I'll be back when the ball is in. So I just finished putting together both of the bones, and we screwed here on both sides of the pipes to put bands on and attach them, and then we put a ball in the middle to allow for the movement of the joints laterally and medially, and then some tape to help stop it from going forward and having a little bigger rotation than it should. So I finished placing most of the ligaments for the right leg synovial joint, and right here, these white bands right here on the lateral and medial side represent the lateral collateral ligament and then the medial collateral ligament. This green elastic right here represents the meniscus, so this would be the lateral side. That would be the medial side. This is medial. The black tape underneath the patella represents the articulating cartilage, and then the red tape above that is the anterior cruciate ligament and the posterior cruciate ligament. They make an X, that's how they're easy to be recognized. And then this band over the patella is the patellar ligament, and I will be back when I have more of the tendons and muscles. So this is the finished product of my synovial joint. From what I've added from the last time I showed is this blue band here, which is the medial collateral ligament, and it attaches on the lateral side of the femur to the lateral side of the tibia, and I've added landmarks here, the greater trochanter, the lesser trochanter, and the intertrochanter line, along with the medial and lateral epicondyle on the femur on both sides. And I have put in the tibial tuberosity right here, it's hard to see under the muscle, and the anterior crest, and above the tibia and fibula, I put the fibularis longus, which is originates from the fibula and inserts on certain metatarsal bones. This muscle plays an important role in the movement of the foot at the ankle joint, so it inserts in the metatarsal and helps flex and move the ankle. And then the red wrapping here, the tibialis anterior, it originates in the upper 2/3 of the lateral surface of the tibia, so like up here, and it inserts in the medial cuneiform and the first metatarsals of the bones in the foot, and it acts to dorsiflex and invert the foot, so bring the foot upwards like that. And the red wrapping on the back here is the gastrocnemius. Then some sports injuries with this. There are a lot of sports injuries related when it comes to the knee, from fractures to dislocations and meniscal tears, but the main injury you hear the most during sports are ACL, which is right here under the patella, the green band that I talked about. And the ACL provides critical stability to the knee running diagonally down the anterior side of it. They are graded on a scale from 1 to 3. A grade 1 sprain is a mild injury to the ACL, while a grade 3 refers to a complete tear. Improperly landing from a jump or quickly changing the direction of motion can lead to a tear in the ACL, and that's the main injury athletes get with the knee. And as you can see, the synovial joint performs all its functions. It fully extends, so it can't hyperextend. It moves medially and laterally a bit, and it flexes like it should be. And that's it.